What is anemia?
Our body is made up of trillions of red blood cells. Red blood cells contain a protein component called hemoglobin. Hemoglobin is used to deliver oxygen throughout the body. And when we have too little red blood cells or we do not have enough hemoglobin, we may develop anemia. Anemia is when a person does not have enough normal blood cells or does not have enough hemoglobin. In addition, another mineral called iron is important because it is needed to help hemoglobin make red blood cells.
What causes anemia?
Anemia can be caused by many different factors. Anemia can happen when your body doesn't make enough red blood cells due to lower than normal levels of certain nutrients such as iron, vitamin B12, folate, and protein, or excessive bleeding.
What are the different types of anemia?
There are many different types of anemia. One type involves nutritional deficiency, such as iron deficient anemia or vitamin B12 deficient anemia. Others include anemia caused by blood loss and more. Vitamin deficiency anemia is a lack of healthy red blood cells due to lower than normal amounts of certain vitamins, such as folate and vitamin B12. It can occur if you don't eat enough foods with these vitamins or if your body has trouble absorbing or processing them.
A second type of anemia is usually caused by events resulting in lowered amounts of blood in the body, such as heavy bleeding in the stomach or intestines, caused by gastric ulcers and pregnancy complications. This blood loss leads directly to lower red blood cell levels in the body.
Why are iron, vitamin B12, and folate important, and what foods have them?
To help prevent anemia, it's important to eat foods that have adequate amounts of iron, vitamin B12, and folate in your diet. Iron and vitamin B12 are needed to deliver oxygen throughout the body, and folate is needed to make red blood cells. Iron can be found in lean meat, chicken, and seafood. It can also be found in spinach, nuts, and fortified foods such as cereal and bread. Folate may be found in a wide variety of foods such as black-eyed peas, dark leafy vegetables, beef liver, and cooked rice. Vitamin B12 is only found in animal-based foods such as fish, chicken, eggs, and milk products.
So for those who follow vegan or vegetarian diets should be mindful to include vitamin B12 fortified foods and supplements in their diet after talking to their doctor. Some elderly patients do not make enough factors to absorb vitamin B12 from their foods, leading to pernicious anemia, a type of vitamin B12 deficiency. In this case, you would most likely need to see your doctor.
Who is at risk for anemia?
There are lots of factors that can increase the risk of anemia, such as your current health state and where you live, but age and gender are the largest risk factors. This is why women, children, and the elderly are the most at risk. Women experience blood loss during monthly periods and childbirth. On the other hand, if children do not receive the proper nutrition to grow, this puts them more at risk. The elderly are also in this category because they are unable to absorb the proper amount of vitamin B12 they need, specifically known as pernicious anemia.
How do I know if I have anemia?
There are multiple signs and symptoms that you could experience if you have anemia. Each person can be a little different and it depends on the cause of anemia. Just know that having the following symptoms does not mean it is a definite sign that you have anemia. Some symptoms include feeling tired often, a loss of energy, and weakness. You may start to notice that your skin becomes paler, you have hair loss that you didn't experience before, and your nail forms a curved shape, otherwise known as spoon nail. In addition, you could start experiencing lightheadedness, headaches, and cold hands and feet.
What should I do if I think I have anemia?
If you think you are seeing some signs of anemia, you should contact your doctor and let them know how you are feeling. You can track the foods you have been eating, any changes in life, and current medications you are taking to tell your doctor. They may have you complete a physical examination or order tests to check your complete blood count and iron levels to confirm if you have anemia. In addition, we host 3 health fairs each year in Sacramento, Stockton, and in the Bay Area region, where we would provide free anemia screenings to the general public. Due to COVID-19, our events are not taking place at this time. However, please visit our website for the latest details of when our health fairs will resume.
Where can I find more information?
For more information about anemia, visit a trusted resource such as www.mayoclinic.org. You can also visit our website at uopvncares.org or email us at uopvncares@gmail.com if you have further questions.